2020, especially in Washington, D.C., so lots to talk about. So let's just jump right into it. A couple of housekeeping items. Everybody's muted if you haven't figured that out yet. If you want to ask a question or make a comment, we want to hear from you. So please go into the Q&A box there at the bottom. Go ahead, click on there. Let us know who you want us to direct your question to. If you're having technical difficulties, go into the chat box at the bottom. And please put your issues in there. And wonderful Sarah from our team and staff will be happy to get back to you and help you out. And finally, we're already getting questions. Yes, you can get a copy of these fantastic slides. Sarah's actually going to send out a link to everybody, I believe, as soon as we get started today, and the slides are available for you. Next slide, please. So for those of you who aren't familiar with eHealth Initiative, we are a nonprofit. We've been around for 20 years and we do research, education, and advocacy. Some of the key areas that we're working on right now, if you were not present last week, we did just release with the Robert Wood Johnson Foundation our consumer privacy framework for health data. And we are looking for feedback on that in the next month. So I encourage you to go to our website, ehidc.org, and check out that consumer privacy framework for health data. It's going to have significant policy and practical influence in the industry. We're doing a lot of work around telehealth reimbursement and information blocking right now, a significant amount of work around social determinants of health and artificial intelligence, particularly as it pertains to COVID-19. And we kicked off our series this year on COVID-19, had about 24 different programs right now on best practices around COVID-19 and technology and innovation and what's happening out there in the field right now, what's actually working, and how you can learn from it. So I encourage everybody to check out our resource center online, ehidc.org. All those materials are free of charge, and please go and download them and read up. Next slide. I'm really delighted to introduce our three speakers today. This is one of my favorite firms in Washington, Mehlman Castagnetti Rosen and Thomas. And we've got two wonderful speakers from there today, as well as our very own Catherine Pugh, who's our Assistant VP of Policy at eHealth Initiative, who will be speaking today as well. We are going to hear from Lauren Aronson, who is a partner. Lauren is a great policy expert, health policy expert with an insider's understanding of how to navigate the political landscape. She's been at the firm since 2015. She's served in senior positions in both the executive branch and Congress. She was actually the executive director, currently is the executive director of the Campaign for Sustainable Drug Pricing. Prior to that, she was at CMS, Centers for Medicare and Medicaid Services, and she also served in the White House under President Obama as the policy director in the Office of Health Reform, and was a key member of that administration's team. We're excited also to have with us today Dean Rosen, who is a partner also at the firm. Dean is one of the foremost policy experts on America's complex healthcare system. He advises a wide range of stakeholders. Prior to joining, he had a number of high-level positions as well. He served as the chief healthcare advisor to Senator Majority Leader Bill Frist on health issues. He also helped draft and navigate final passage landmark legislation, creating the Medicare prescription drug benefit. He served as a staff director for the Senate Subcommittee on Public Health and Majority Counsel for the House Ways and Means Health Subcommittee, and health policy coordinator for the Senate Committee on Labor and Human Resources. Sorry, Dean, that was a mouthful, but got through it. We're delighted to have both of them. I know a number of you are familiar. We've had this group come and speak to our members and participants every year for probably the last 15 years, and I think everybody really looks forward to this session. So we're really excited to learn and hear from both of you today. So welcome.
Thank you. Can everyone hear me okay?
Yep.
Great. Well, thank you for having us. We have very much enjoyed our relationship with EHI over the years, and we've been honored to have worked with Catherine in her previous role. So EHI is very lucky to have Catherine, and we so appreciate the opportunity to brief you all today. As Jen mentioned, I'm Lauren Aronson. I'm a Democratic partner at Mehlman Castagnetti. These are usually much more fun when we do them in person because I get to stand on the left as a Democrat, Dean gets to stand on the right. I'm a few inches taller. I wear heels just to make it even that much more fun. But, you know, we worked together for a long time. We're like siblings, although this time of year with the election, it gets a little dicey. So we're very clear to stay in our corners. And the only time of year that we don't dine together as a firm is on election day. So it's going to be an interesting one this year. Just to give you a quick 30 seconds on our firm, Mehlman Castagnetti has been around for 15 years. We do a lot of work in every sector, but Dean and I primarily work in the healthcare space. So we work with hospitals, insurers, lots of folks in the health tech industry, physicians, and so forth. So we're kind of like Noah's Ark. We represent a little bit of everyone, but we are very excited to be here with you today and talk about what's happening both in the near term and what's going to happen also in the long term as we approach the election potentially next year. Next slide, please.
Yeah, so thank you guys. I'm gonna kick it off and just add to Lauren's thanks. We're really excited to be here with Jen and Catherine and have so much respect for the health initiative and the work you've done throughout the years. And we will go through our presentation, but we are really looking forward to your questions and kind of rolling up our sleeves and diving into it. So the first thing I want to talk about is we are in a time of unprecedented change. We know that from a technological standpoint. You all have been on the front lines of it and seen just in the last few months the growing acceptance, for example, of telehealth. But we also know that technology had a huge, important and disruptive effect on our society. Obviously, COVID has disrupted all of our lives. We've had social movements that are bringing about the greatest change in my lifetime, and that's saying a lot because I was born in the '60s. But if you look at it as well, our politics is also undergoing rapid change, and this is the 2 decades between 1960 and 1978. And if you just do one click there, Catherine, what you'll see is that in this 2-decade period, there were 3 elections, 1960, 68, and 76, where we had what we call change elections, a big change in control of the House, Senate, or the White House. If you go to the next 2 decades, between the election of, starting with the election of Ronald Reagan, we had exactly 4. Then we moved to the following decade, beginning in 2000, with the election of George W. Bush. And what you see is, if you just click one ahead here, is that 8 of the last elections that we've had have been change elections. So the new normal is to bet on change ahead. And that may be one of the reasons that not only our everyday lives, but our politics feel so disruptive, and why you're doing the call today, because we are more often than not planning for a transition, planning for change, and planning for less stability as opposed to more stability in government. If you go ahead to the next slide, Catherine. On top of that, 2020 is a year unlike any other. I was not here in 1919 or 1957. I was barely around in 1968. But you know, in all those other years, for example, going back to 1919, we had an economic downturn. We had the Spanish flu. Obviously, we had mass protests in the country, but it was not an election year. If you look at 68, we also had a pandemic. We had mass protests and uprising as the result of the civil rights movements and tremendous progress. We had a major election that year, but we did not have a recession. This year, 2020, we've got all 4 of those present. And so if it feels like it's even more disruptive than ever, it is even more disruptive than ever. Just go one forward to the next slide. And I think Lauren's going to talk a little bit about what's really shaped things. You know, about 6 months ago, when we were actually all coming into our offices full time, we sort of thought that we would be talking today primarily about Medicare for all, or about repeal and replace. And we would perhaps be looking at the impact of one of the greatest economic booms of our time. What we're now looking at is mass unemployment and a Congress that has responded and an administration and governors that have responded pretty significantly, as well as the health sector, to what will probably be the defining issue of this election, which is the response to the COVID pandemic. So Lauren, I'll kick it over to you.
Thanks, Dean. And before we get to the next slide, I think just one thing that's interesting to note, particularly to Dean's last point as to how the COVID response and the pandemic is playing into the election, I think it was very clear from the Democratic National Committee's convention a few weeks ago that the response to the pandemic is a paramount argument that Vice President Biden is using against the Trump administration. One of the things that I really noted from the DNC meeting as well was that you had Vivek Murthy, who's the former US Surgeon General, was a prominent speaker. And so we had not only attacks of character, which we'll talk about against the current president, but really how this current administration has responded is a paramount issue for how Biden's is approaching the election and will approach, potentially governing. But let's talk about for a moment in the short term. So just putting a little bit in perspective, everyone obviously on the call knows that the House and the Senate have passed numerous pieces of legislation to address the COVID crisis. So what's interesting about this slide is just taking a step back for a moment and thinking about how much money we've actually spent from a federal perspective. So far, we're looking at, well over $2.5 trillion, almost $3 trillion in federal dollars that have been spent as responding to the COVID crisis. You put that in perspective relative to the stimulus package that passed when we had the 2009 financial crisis, which was about $787 billion. Thinking about TAR, you've got Hurricane Katrina. So really what the government has spent so far outweighs anything we've spent relative to previous crises of a similar nature. So as we think about what does this mean for a next COVID package or for potential issues around the deficit or the debt, really thinking about how much Congress has spent so far is really important. Next slide. So just to talk a little bit about the short term, we've obviously seen a lot of political posturing. We've had this slide actually put together for a few weeks now, and we had, I think originally thought we originally put this together in May and June that we would have a package come together before the August recess. But now we are here on September 8th, and we still do not have the next version of a package, although Mitch McConnell has announced today that there will be a Republican package coming out today, and the Senate will be voting on it shortly. So that said, the Democrats and Republicans are far away. We have Democrats prioritizing things like more funding for states, funding for testing and for coverage, really digging in on some of the UI issues and really ensuring that people do have money in their pockets. From a Republican perspective, obviously liability protections are a key priority, focusing on also another round of stimulus checks, but probably not as generous as a Democratic perspective, some temporary and limited and targeted funding, whereas Democrats want to spend a little more boldly. And then things like UI payroll, student loans and evictions is something the president has focused on. So, substantively, they're pretty far apart. And normally we see in the course of all of these bills coming together, there's a lot of political jockeying that happens, but at some point the press release stop and they actually start having negotiations. What we're seeing so far is that even over the course of the last couple of weeks, every time Speaker Pelosi talked to Secretary Mnuchin or talked to Mark Meadows, a press release followed, which meant we're really talking more about posturing at this point than we are actually getting down to substantively negotiating. And that was even more evident today with Mitch McConnell putting a bill on the floor this week when Democrats have been asking for a bill for quite some time. And Pelosi and Schumer came out pretty quickly and said, this is very lean. So in terms of something coming together in a short term, I think it's very challenging to see how it comes together at this point. But the other thing that's kind of playing at point right now is that we have the government funding expires on September 30th. So there's an open question whether or not the CR will carry any COVID-related items. Speaker Pelosi and Secretary Mnuchin have discussed bifurcating the two, so they're not wrapped up. But as the political process continues to evolve, it's entirely possible we could see the two come back together.
Just you can go to the next slide, but just a couple of points. I think number one, Lauren, if you're keeping score, I think this is at least the second or maybe third time that the Republican leader in the Senate has tried to put forward a bill. And I think the last time I worked in the Senate, the Democrats could offer amendments to a bill if they'd let it get on the floor. But I think they.
Whoa. Just so we're clear, there's normally a negotiation process before a bill comes to the floor. It's not just that the leader decries the bills on the floor and says, all right, vote.
Yeah, I think you're absolutely right. I think that's how we got Obamacare, through a lot of negotiation. But anyway.
I had 60 votes, so it was different.
But the bottom line is both parties are trying to say, look, here's what we're for. I mean, the Democratic bill, in all fairness, the $3 trillion bill that the Democrats passed a month and a half ago with virtually no Republican support and absolutely no negotiation with Republicans, was on top of the nearly $3 trillion that's already been spent. And that's the way that both parties are playing things, which is they are far apart. And you've got a significant portion of the Republican party that thinks that we should be doing things that are very, very limited, very, very targeted here, and that the most important thing is to continue to just try to get the economy up and going, and that there would never be able to reach the amount of spending. So every bill has gotten progressively harder. So that would just be one quick point I want to make. I'm not at all confident that things will come together, but we'll see. In terms of the next response. The second thing I just did want to underscore, since it's the eHealth initiative, is that I think there's a lot of, despite our partisanship here, there's a lot of bipartisan agreement that telehealth has been a key part of the response. And you've seen, frankly, some legislation, but a lot more done on the regulatory side through CMS and through the emergency waiver authority that the Secretary has under the public health emergency declarations to provide relatively broad flexibility in terms of, let's say, getting rid of the Medicare's originating site restrictions, providing for parity and reimbursement. And that's been really critical in the response, because even if it's not a COVID-related treatment, as those of you who are involved in providing care have seen, people cannot safely leave their homes, don't feel safe going to doctor's offices or hospitals. And I think this has been a real proving ground for telehealth that will probably have more permanent changes. So whatever happens with the continuing resolution or the next COVID relief bill, again, in normal times, we might have a negotiation that would lead to a compromise. We'll see. But I think one great winner in all of this for the future will be some of the changes that we've seen in terms of telehealth. And sometimes it takes a bit of a crisis to wake policymakers up. We did want to transition beyond sort of the immediate to setting up really the question that Jen and Catherine and team sort of posed, which is, where are we heading in this election? We noted it's a time of change. We'll talk a little bit about how the parties may run here, but clearly, while there's some overlap on some issues, there's also some big differences. This is really an outline of the Trump administration health agenda, prescription drugs, where the president's been fairly bold, has put out a number of proposals through executive order. Congress has not been able to reach a bipartisan agreement, but the president not only has a disruptive style, but his policies have been disruptive even relative to past Republican presidents on things like trade, on things like immigration, and on things like healthcare, particularly on drugs. He's taken a position that has not traditionally been a Republican view of the fact that drug prices are too high and there ought to be significant government intervention to do it. There's also been a lot of support for value-based care, disruptive care. Telehealth is one example where even before COVID, the administration have moved pretty aggressively in the Medicare Advantage space to provide additional flexibility around supplemental benefits and in the physician payment rules to try to push the outer bounds of what could be done, but also through transparency and bundles and other things. It's been fairly aggressive, and I think in a lot of ways, a continuation, or some might even say an acceleration, of what the Obama administration started and put in place through some of the CMMI demonstrations and other things. Transparency, I mentioned, is a piece of that. Affordable insurance, this is where the parties start to differ, is really even on issues where they align sort of in terms of value. They really are in very different places in terms of coverage, and Lauren will talk about the Biden proposals in a moment. But in a nutshell, the Republican view of the world is we can get more people covered if health insurance is more affordable. It's not affordable now because the ACA had too much regulation, too much control at the federal level. And so they've done a number of things through regulation, including authorizing short-term limited duration plans, a version of association health plans and others, and looking at other executive orders, but also through the courts and joining states to challenge the fundamental legality and constitutionality of the ACA. And I think the Supreme Court just scheduled oral arguments here in the fall, so we could well have a court decision this term that maybe provide some legal certainty, but maybe also, just as it did in the previous ruling on Medicaid, provides more uncertainty where Congress is going to have to step in. But the Republican plan has been to repeal and replace, but have been a lot more certain on what the repeal looks like than they've been on what the replacement looks like. And as a result of that, even when Republicans controlled the House and the Senate, and the presidency in the first 2 years of Trump's term, they were not able to get to repeal. But that's a major area of difference. On some other things like opioid and public health response, there's a lot of, there's generally some overlap. COVID response, and I'll stop with that. I know we'll have a lot of discussion and debate about it, but obviously this administration, they made a big point not only during the convention, but the president makes a point every day that he's responded aggressively, and he'll certainly make that case that he stopped immigration from China, that he stopped travel from China early on, that he intervened, that he's pushing fast on therapeutics as well as a vaccine. And the Democrats will say that the response has been disjointed, that there's been sort of a delegation of sort of federalism to the states that hasn't been by design, but has just been because the administration hasn't done it. And so, as we talked about a bit earlier, but I think the COVID response, both the economic as well as the health disruption, is probably going to be the major defining issue, although there are other issues, including race relations, crime, and others that will be a huge focus of this election too. Lauren, you want to talk a little bit about the Democratic agenda?
Yeah, can we go to the next slide, please? So talking a little bit about Vice President Biden's healthcare priorities. So first and foremost, obviously building on the Affordable Care Act is a key priority for the Vice President and Senator Harris. We saw obviously a lot of conversation, a lot of debate among the Democrats and the party over the last few months about whether or not we're going to build and expand and enhance the Affordable Care Act, or whether or not we're going to move to Medicare for all policy. And clearly, you know, what won out in the Democratic primary was more of a focus on the Affordable Care Act, but there was a lot of consideration given to how do you bring in that other part of the party that is on the far left that really wants to see a Medicare for all proposal. So what's in the Biden-Sanders unity document, which included a variety of thought leaders representing both Vice President Biden and also Senator Sanders, was really an enhanced Affordable Care Act policy that would include things like additional policies to expand Medicaid, providing more flexibility in terms of affordability, and most notably was a public health insurance option that would allow not only individuals who don't have access to affordable coverage in the individual market, but would also allow individuals in states that have not expanded Medicaid or individuals who find their employer-sponsored coverage unaffordable to access that public health insurance market. So there really was a meld between the two to try to bring both sides of the Democratic Party together and really build and enhance the Affordable Care Act. In addition to that, obviously lowering prescription drug policies is a big issue for Vice President Biden as well, similar to what Dean noted for President Trump, but obviously a little bit different perspective as to how you would go about it, allowing Medicare to directly negotiate prices for prescription drugs, obviously is a key pillar of the Vice President's platform. Also taking away the tax benefit for direct-to-consumer advertising for pharmaceutical companies is also something in the platform, and obviously drug importation, which has been around for quite some time, also something the current administration is looking at as well as a key pillar of the Biden plan. Generally also lowering healthcare costs. A lot of bipartisan work has been happening on medical surprise billing. That's also a key piece. Healthcare access, whether it be expanded access to contraception and mental health parity, are also kind of critical. And one thing that we didn't note in here, but obviously is another key element of Biden's plan is, you know, the growing health inequities that we've seen, not only, you know, across the healthcare sector, but more broadly in this country. We've obviously had a very vociferous debate recently about whether it be policing policies and various demonstrations and all sorts of inequities that are happening, particularly with the murder of George Floyd and many others. And then seeing the COVID response where you have, you know, ethnic and racial minorities are disproportionately affected by COVID. So bringing all those issues together, I think, is going to be a key pillar for Vice President Biden. overarching all of this, of course, is going to be a response to the pandemic. And so, as I noted earlier, I think that the key first thing out of the box, if Vice President Biden were to win, is going to be a robust national response to the pandemic, focusing on all the shortcomings of the current administration's response, thinking about the national stockpile and so forth. And then I would say ACA and these other issues are intertwined, but secondary. One of the questions that came up in the chat box also was a little bit of who's advising Vice President Biden. So I'm happy to focus on that for a second. A lot of Biden's inner circle at this moment are mostly former Biden staffers. So thinking about Ron Klain, who played a significant role with the Vice President in the response to Ebola crisis and H1N1, someone who's got considerable experience. I noted earlier Vivek Murthy is playing a considerable role as well in terms of daily COVID briefings. We have David Kessler, former FDA administrator, is also playing a significant role. We have a lot of also former Obama administration officials, whether it be someone like Todd Park and others who are playing a role from Health IT. So we have a lot of former Obama administration officials, a lot of academics who are playing a key role in helping the vice president put together his policy platform. And then finally, one thing I obviously want to note is the cancer moonshot, which is something that's particularly personal to Vice President Biden, will obviously play a role as well moving forward. Next slide.
Yeah.
So, Dean, do you want to talk a little bit about how the president's going to win re-election?
Well, the president's in a much better position now than I think almost he has any right to be, given the crisis that we've seen. And, you know, I think what you've seen coming out of the race, I know we've got some Q&A in here about race relations, is a couple things. This is, Lauren and my thesis is that there are going to be, just to be clear, many issues. We're not a single, very few voters are sort of single issue voters, even if they have priorities among votes. But it's going to largely be a referendum on COVID, in part because that's going to be this, you know, one of the more significant issues. But we're also clearly, and frankly, to Lauren's point, the reason the Democrats spent so much time during their convention on COVID is because Vice President Biden, if you look at the polls, is doing better than President Trump on who would do better in terms of COVID response, who would do better in terms of race relations. The president is, as a result of that, trying to use the race relations issue as a bit of a kind of a jujitsu issue to try to portray President Biden and Vice President Biden and Senator Harris as sort of out of step and not supportive of the police, and sort of trying to turn that debate into one that's focused on sort of crime and violence. And so it'll be interesting to see. That's clearly one tactic. But on the healthcare issues, and on COVID in particular, what I would say is two things. One, healthcare and health coverage are issues that are, if you look at the polls, are animating Democrats. They are not issues that are animating Republicans, which is why the Republican talking point on coverage is the ACA is terrible, and Medicare for all, or a Medicare buy-in, or a public health option or public option would make things even worse. But the president is, what he's going to say on the key issue of the day is, you know, how does he get out of this jam when we've got record high unemployment, although those numbers are improving, but high relative to almost any other time other than the Great Depression, and certainly arguably the worst pandemic that we've seen in decades, if not century. What he'll say, as I said at the outset and referred to, is that the president took decisive action early on, limited travel from countries like China that were initial sources, that he's moved and tried to press the levers of government. And by the way, I don't think he minds the stories about, you know, him pushing the FDA and others to move forward on a vaccine, that he's going to tout his leadership in providing things like more money for testing. And you heard even during the Republican convention, those of you who watched, there was a shout out to telehealth and how important that was. So he's going to cite a number of actions in the healthcare area that he took. Number one. Number two, President Trump is also expert at shifting blame, and he will shift blame to governors, as he's already done, that weren't prepared, a biased media that doesn't give him credit, the Obama administration and other Democratic administrations, and frankly, Republican administrations that didn't leave in place or put in place the tools to prepare him. The fact that Democrats, up until Frankly, March, we're focused, or end of February, on impeachment. Bureaucrats in these agencies that are preventing him from moving even faster, the World Health Organization, and mail fraud, which will be another issue we'll talk about. And I think he's also going to make the case that you just cannot trust Joe Biden, that he's not the moderate that he's made himself out to be. And even if he was, his capabilities are not what they were when he was in his prime, and he's being led further and further to the left by a very aggressive and party that's moving way sort of radically to the left. That's the case that the president's fundamentally going to make. You heard a lot of that being made. Whether or not it's going to be successful will be up to the voters, but I think that's the core of the case the president's going to make. And Lauren will now tell us how the Democrats will prosecute their case.
With pleasure. So, I mean, obviously, as we talked about a little bit earlier, the vice president's going to be focusing primarily on a character issue. So I think that the character issues are prominent. We saw that play out not only in how the vice president defined the president in terms of his current actions and everything he said, but also in how the vice president wants to define himself. We saw a lot during the Democratic convention really focusing on Joe Biden and on his roots and his family and how he connects with people. And so I think that's going to be a key pillar as to how we see him talk about taking on the president. And then beyond that, obviously, we talked a lot about this, but the administration's failure to deal with the current COVID crisis. So just thinking now, if you look at our current slide where we have over, almost 6.5 million cases of COVID in this country relative to how big the US is, we have almost 20% of COVID cases, across the globe, but we're less than 4% of the US, of the global population. So thinking about also how many deaths we had relative to other countries, that is going to be a key part of how the vice president talks about this administration's failures. So thinking about the pandemic, the economic uncertainty, talking also about character and lies and mistakes, and then more importantly, the vice president's going to talk boldly about how he has the experience, his team has the experience. They dealt with the crisis in 2009 coming out of the financial collapse of the economy, talking about the response to Ebola, and talking about the response to H1N1. The vice president, for good or for bad, has been in Washington for 40 plus years, and he has the experience to know what needs to be done to put us on a better pathway, whether it be responding to a pandemic or economic certainty, et cetera. So, it's going to be focusing on the administration's record on COVID, on the president's personal character, and then how we offer a better alternative. Next slide. So just taking a step back here for a second, obviously in addition to the presidential race, focusing on the House and Senate is also critically important. I'm sure Dean can figure out a scenario how the Republicans take back the House, but I think from my perspective, that is unlikely. Democrats are on pretty strong footing, particularly this Congress, as it relates to maintaining control of the House. However, the Senate is in play. I'm more skeptical that Democrats are able to take back the Senate, but there are a variety of opportunities for both sides to take back some Senate seats. So I think, obviously from a Democratic perspective, looking at Tom Tillis in North Carolina, Cory Gardner in Colorado, Martha McSally in Arizona, those are our key opportunities for Democrats to take back those seats. And then on the flip side, we have certainly many Democrats on our side that are vulnerable, thinking about Doug Jones from Alabama, et cetera. So when we're thinking about the election, it's not just about the presidential election, it's also thinking about the downstream effect on the House and Senate races. Next slide.
Go ahead.
Sorry, go ahead. Dean, were you going to say something?
No, you got.
Well, I think that obviously the Senate control is obviously at risk in 2020. But if Biden does win, obviously, we're in a situation where Biden could carry the Senate as well. But then thinking a lot about where we are the next Congress, we could see a significant change there too. But just to focus a little bit more on some of the races that are at play, I didn't mention Senator Collins in Maine. I would actually say, even though Charlie Cook says it's a likely Dem, I think that's probably more of a toss-up, to be honest, at this point. Senator Collins is incredibly well respected and popular in Maine, and so it's obviously a key race for her. Senator Peters in Michigan also being a battleground state is something I think we feel confident in, but obviously knowing how much it's a priority for the president, there'll be a lot of political dollars spent in Michigan. And Dean, I'll certainly give you the opportunity to talk about your home state of Minnesota because I know you want to.
I was just going to comment that, what you see is fewer and fewer people who are willing to or able to split their tickets anymore, and so as probably the presidential race goes, depending on how big the victory is on either side or how close it is, probably so goes the Senate. And just to note that this is based on Cook political data, which is probably the Bible of objective analysis. And this was, as we put our slides together a few weeks ago, a lot of this has changed. For example, the Susan Collins race has been moved from a likely Dem to a toss-up. The Cory Gardner race has moved to a toss-up. The Arizona McSally race has moved more to lean Dem. So there'll be a lot of moving around, and some of that is what you'll see is just the Republicans who've left the president will start to come home. Not all of them, maybe not enough of them. It'll be a very, very tight race overall, and the Senate will probably hang in the balance, although I do agree with Lauren, the House is very, very likely to stay in Democratic hands. Why don't we go to the last few slides? I want to make sure we get to Catherine into questions. A couple key points on this. First of all, this election is going to be probably unlike one that we haven't seen in a long time. We're used to this at the state level, where sometimes Senate races, I'm thinking about the Kristen Sinema, Martha McSally race in a couple years ago, where on election night, McSally looked like she won, and as the votes got counted over 2 or 3 or 4 days, Kristen Sinema became the Democratic senator because of as the mail-in ballots were counted. We could have nearly half of the ballots in this country, which would be almost threefold the last presidential election, done by mail-in as we head into this sort of pandemic election. To note, the number of people who are eager to vote and likely to vote is at an all-time high. 2018 saw the highest midterm voter turnout since 1914, and in 2019, people are telling pollsters they're even more excited. The middle slide, the middle data, I won't spend a lot of time on, but obviously you're going to have these slides. What this just shows is it's a little bit of a proxy. White voters with no college education tend to vote Republican. College-educated white voters have tended to vote Democrat in the last few elections. Non-white voters have tended to vote Democrat. So it just shows you in some of these key toss-up states where both President Trump and Vice President Biden see pickup opportunities. And then I think this goes to the final column here, the issue of COVID and mail-in ballots. And the fact is, if you see one winner on election night and then a day, 2, 3, maybe weeks or maybe months later, we see different ones, we could have quite a, and increasingly folks are talking about this, we could have quite a disruptive couple of weeks or couple of months. The Bush v. Gore happened in my lifetime, but this is one where President Trump is already starting to lay the groundwork for, saying that mail-in voting is inherently fraudulent. And I think with the country as divided as we are, we will see great fears of both voter suppression and inappropriate voting, and probably an election that maybe for the first time in a long time divides us more than unites us. So these are all things, and the pleasant thing that we can look forward to on election night. I think we just have a couple more, Catherine, if you go ahead here. I think this is just our last slide, and some of the questions that have come in we've seen, I know we'll get to in the Q&A, but maybe just to address some of these issues of sort of looking ahead and the shifting health policy debate. We've talked a little bit about health policy throughout, although without a lot of specificity on the details of telehealth. But a couple of points here to summarize, and then I know Catherine's got some comments and we'll look forward to the Q&A. But as Lauren and I think both believe that what we look like a 2020 election fight between a Republican position on healthcare of repeal and replace. Yes, they're for pre-existing condition protections, but beyond that, very unclear what their subsidies would look like if they actually repealed the ACA, versus a Democratic position of Medicare for all. That's really, I think, been eclipsed by a question in the healthcare area of who is best prepared to respond to the COVID crisis, both economically as well as from a public health standpoint. Lauren talked about the enormous amount of spending that Congress has done on an emergency basis. The Congressional Budget Office was out with a report last week showing that the debt and the deficit will be largest in history. The debt is now larger than all of our spending in the country in an annual basis. And deficit concerns could resurface under either administration, and both as even clearly under Republicans who might go to a more austere government and looking at trying to do things like if President Trump is reelected and Republicans take over the House or do at least hold control of the Senate, putting more pressure on states with fewer dollars through Medicaid, that could be one. But even Democrats, as they look to pay for other priorities, could look to the healthcare sector as a place to cut costs, whether that be physicians or providers or health insurers or certainly drug companies. The public may be more accepting of a broader government role, given the COVID response, and also given the divisions in the country and the lack of trust in government by some, even more skeptical of a government response. We can expect a lot of oversight. You don't spend $3 trillion without the government wondering who got what, why, was it fair? And I think that will continue into next year. You will see, as you've already started to see, some articles of folks who have huge bottom lines and are doing well in the stock market who've gotten some COVID relief funds. That oversight will continue. A number of issues moving forward. The telehealth, and I'll focus on that for a moment. There's a number of issues here. We did provide, after some time, a great deal of flexibility. Telehealth could be provided without site restrictions. There's been parity in reimbursement. That's licensure restrictions have been waived temporarily. We've allowed greater flexibility for non-physician providers to prescribe and other things under telehealth. Much of that will get rolled back when there is not a public health emergency declared. And the question will be which of those policies will go forward. I think a lot of them will. I think the site restrictions and other things which clearly are outdated, why shouldn't we be able to sit in my office and be able to talk to you as we're doing today? Why shouldn't we have that conversation? I think those will probably be lifted over time. But remember, those restrictions are in place because they create less cost. If you cut off people's access to telehealth or other forms of care, it's going to cost the government less. And the question is, what other kinds of things might crop up? So I think it's going to be harder to see us having parity in reimbursement going forward between an in-office visit and a telehealth visit. I think that becomes probably too costly in the near term, but something that will be debated. And some of the other restrictions around who can participate or what other restrictions might take their place. Will public health get more stable funding? Will we finally open our eyes to the persistent health disparity and health equity challenges that COVID has only underscored? Whose responsibility is it to pay for these things? Is it a broader societal responsibility, or should we mandate that health insurance do it? And then finally, I think one last thing to note, and because it's not just policy, but politics of who gets what, I think COVID has also scrambled in my mind, and Lauren, I talk about this a lot, the policymakers' perception of stakeholders. Doctors and hospitals have clearly been viewed, nurses and others, it shouldn't just be obviously doctors, but as frontline heroes in responding to the crisis here. Drug manufacturers who've been criticized by both parties for charging too much are going to be a huge part of innovating if we do get a vaccine or certainly treatment. Laboratories developing novel tests, rapid tests, expanding capacity. Telehealth, I think if you look at polls, a lot more support for telehealth and a lot more comfort with telehealth. Insurers is sort of a mixed bag. They're trusted less than some of the other providers. Some of the insurers have seen helping to coordinate great care. Others have been seen by the public as a barrier to testing and coverage. So the other equation is how COVID has kind of scrambled the perception of these various stakeholders. So I think with that, Catherine, we turn it over to you, and then we're happy to answer any and all questions that we have time for.
Great, thanks, Dean. Thanks, Lauren. That was a great presentation. So I did want to just touch base for a few minutes on the fall 2020 congressional outlook, because while it seems that everything has been taken over by the elections happening in November, there are a few things that Congress has to address before the elections in approximately 16 legislative days that there are between now and election day that Congress will be in session. So what we have, and usually the month before an election, there really is only time and political will to address the must-pass legislation. So this year we have the fiscal year 2021 National Defense Authorization Act. I think negotiations are well underway to have that fully passed before October 1st. And then, of course, there's a little thing of funding the government past October 1st, which is the start of the fiscal year. And likely we'll see another continuing resolution to fund the government for, I'm guessing, 2 to 3 months to the end of the year, setting up lame duck legislation here after the elections. The question is, and I'm seeing more since I've done these slides, that they're likely to be a clean CR passed relatively quickly, and that there are Medicare and Medicaid policies called the extenders that will expire November 30th. And so Congress will have to address those policies either before the end of the year or before on the continuing resolution before October 1st. Like I said, it's seemingly less likely that they'll address it through the continuing resolution. Those extenders cost money, and that's why they get extended for, well, historically 2 years, but this time around it's been going with those COVID packages, so it's been 2 to 3 months extensions, which is a little bit unusual. But those extensions are things like the disproportionate share hospital funding and some other issues that need to be addressed. And then Dean and Lauren mentioned this earlier, are we going to see another COVID relief package? I think that's a big question about whether that gets addressed before the end of the year. Lauren mentioned it seems that the negotiations are far apart right now. I actually just got word and saw the Leader McConnell is likely to bring up his version of the skinny, what they're calling a skinny relief package in the coming days. And it seems like it's pretty far apart here. Okay, next slide. Great. Now, so a lot of you have asked in the questions box and submitted your questions ahead of time, and they were all focused on telehealth. And Dean touched on a lot of issues here in his last slide, but just to dig in a little bit deeper and then talk about EHI specific work in this area. As Dean mentioned, the COVID-19 waivers that we've seen to allow for broad reimbursement under Medicare program are temporary, and they're tied to the Department of Health and Human Services public health emergency period that's been declared for COVID-19. And so once that public health emergency period is rolled back by the Secretary of HHS, it expires, I should say, it expires or the HHS Secretary chooses not to renew it, we go back to how telehealth was reimbursed pre-COVID-19. So only patients that are for Medicare, only patients who are located in federally defined rural areas. A patient also, for the most part, can't be located in their home. They have to be in a facility, a provider facility. So EHI has been really stepping up our advocacy over the last few months because we know for our members, our patient group members, and our provider group members that continued reimbursement for telehealth is a #1 priority. And so we joined with a number of other associations to lead a letter to Congress that had 340 signers outlining our priorities, what we think Congress should address to make Medicare telehealth policies permanent. Next slide. And we've seen, I'm sure that all of you have also seen that a lot of members of Congress have introduced telehealth legislation since COVID-19. Now it's the hot item on Capitol Hill, and it's a bipartisan issue too. Both Democrats and Republican members of Congress have introduced telehealth legislation on any issue you could think of. We at EHI from our perspective, legislation that most closely reflected our stakeholder letter that I mentioned earlier is the Protecting Access to Post-COVID-19 Telehealth Act of 2020, HR 7663. That was introduced by bipartisan leaders of the Congressional Caucus on Telehealth, and they joined us, all co-sponsors joined us for a legislative advocacy kickoff on HR 7663, and that was a couple of months ago. And since then, we've also, EHI has applauded Chairman Lamar Alexander, Chairman of the Senate Health Committee, on the introduction of the Telehealth Modernization Act of 2020, which also addresses a lot of the issues that we outlined in our letter to Congress. Next slide. And then on, in terms of the administration, what we've seen, as Lauren and Dean mentioned, HHS acted, CMS acted quickly to implement the waivers. It's really been, to the administration's credit, really amazing what they've allowed for telehealth during the pandemic. And certainly it's been required, certainly in the first few months, as many provider offices and hospitals were required to close for non-emergent health issues, and many were only able to access their providers via telehealth. And that really led to, on August 3rd, President Trump signed an executive order that requires the HHS secretary to propose a regulation with 60 days to extend temporary Medicare telehealth policies to the extent possible beyond the COVID-19 public health emergency period. And many of these proposals were included in a regulation that was proposed that same day, which is the calendar year 2021 Medicare Physician Fee Schedule and Quality Payment Program Proposed Rule. What a mouthful. But that, as you guys mostly know, that is an annual rule that is proposed that sets Medicare policies for the following year. CMS has proposed to keep many additional services after the public health emergency, but as I noted earlier, CMS has no authority to remove geographic or originating site restrictions, and Congress must act in order to allow that for following the public health emergency period. Next slide. And I think we've all mentioned the telehealth continues, is one of the few issues in healthcare, I think, that continues to have bipartisan support. I will say that from our conversations on the Hill, committee staff on both sides of the aisle remain hesitant to make sweeping changes, certainly prior to the elections, unless because of cost and quality concerns, until they see the data on how telehealth has gone over this public health emergency period. Whereas telehealth advocates, I think, me being one of them, will argue that we've already made the case, and COVID is just another example of how telehealth can really serve patients who might not otherwise be able to access healthcare. Most recently, we've seen inclusion of a one-year extension of a waiver authority and a requirement of a MedPAC study, as I mentioned, on the data that's happened over this public health emergency period to inform permanent changes. That was a provision included in the Senate's last COVID proposal, which was the HEALS Act. And I think depending on the elections, on how the elections go, we'll see the biggest telehealth push come in the lame duck session. And that's certainly what EHI is gearing up for, is an advocacy campaign in the lame duck session. I think we could see certainly a one-year extension of the current waivers included in the continuing resolution bill, because providers are concerned and patients are concerned about going over what we've been calling the quote-unquote telehealth cliff, of a day that comes when all of a sudden overnight, just like the waivers came in overnight, that they'll go away overnight and a lot of patients will be without care. And I think with that, we can turn it over to Q&A.
Great, excellent, thank you. Thanks, everybody. Okay, so we've got about 5 minutes left. I have a number of questions here. I'm gonna see if we can do kind of a quick lightning round. We'll try this out. Let's go real quick. Dean, a red mirage, what is it? Will it happen?
I guess the red mirage refers to, I touched on this a little bit earlier, the issue of voting. And the fact is that many more Democrats in most of the states either feel comfortable or because of their situation will vote via mail-in ballot. And the way most states work is they count those mail-in ballots after they count the votes that were cast on election day. So the red mirage, I think, refers to, I don't like the term personally, but what it refers to is you could come away on election night, both in some of the states and nationally, believing Republicans have done better, including the president may have won the electoral vote, or looks like he's on his way to doing that. And then over time, not over hours, but over days or weeks and through legal challenges, it looks as if the Democrats or even the president, Vice President Biden, will have won the presidency. And that, I guess, refers to the mirage. And I think that if that scenario plays out, that's the description of it. I probably don't, we probably don't have time to go into the hour of discussion it would take, but if you look at how divided this country is right now between red and blue, Republican and Democrat, how passionate people feel about their parties, that kind of scenario you could see could lead to great disruption, even civil unrest. I think that's really the fear that's there, that people are starting to talk about more.
I'll just add something real quick. I mean, I do think I agree with Dean. I think there's also, we've always historically had a smooth transition of power, whether it be from, the Clinton administration to the Bush administration to the Obama administration. And I think there's certainly, I think, a lot of concern that there will not be a smooth transition of power at this point.
So when will we have our president? Best guess. Lauren.
I agree with Dean. I don't think it's going to be November 3rd. I think it's going to take a couple weeks. I'm petrified, to be honest, for all of the reasons Dean outlined, that we probably won't know until mid-December. Mid-December.
Dean, what's your guess?
I hope it's not more than a couple of days. I'm fearful it could take a couple of weeks. I'm really fearful it'll take a couple of months. I'll say end of November.
Catherine, you want to take a guess?
I don't know, but after listening to Lauren and Dean, I'm very nervous. No, I don't think, I mean, Dean was right with the number of mail-in ballots. I don't see it happening. My hope would be it would be within the week, but we shall see.
Okay, October surprise. Will there be one? What will it be? Dean.
There's always an October surprise. I think the question is, what is it? But every year, not even thinking about everything that's happening right now, there's always an October surprise. No question.
What do you think it's going to be?
That I have no idea.
I think we're gonna, I think we're gonna have an announcement that we're very close to a vaccine. I think there could be others that are out there, but I think that's one that you could see political fighting about. And that's actually one that concerns me a little bit as well, because, most of the vaccines, some have been very risky, some have been dangerous. Most of the vaccines we've had in this country have been very safe and very effective. But I worry that with everything being politicized or potentially getting approved on an emergency use authorization or EUA, that there's political lines that are drawn around a vaccine. But I think that's a question. If people think we're close to a cure, does that change people's perceptions of the outcome of the election? We'll see.
One thing you guys didn't address was the debates. Do you think that that's going to look different? Do you think there'll be fact-checking? Thoughts on that?
It's a great question. I mean, obviously, it'll be interesting to see what the format of the debates are themselves. I'm not sure fact-checking matters anymore, to be honest. I mean, given just everything that's happened over the last couple of years. But I certainly think they will be, they'll be robust. And I'm not sure how much it's actually going to matter, to be honest. To be honest, I'm more actually interested in watching Kamala Harris and Vice President Pence debate than I am personally actually seeing Trump and Vice President Biden debate.
Jen, two comments there. One where I think it could have a difference. The other, and just in terms of the way we consume our media these days. Now, number one, I think, and hopefully this doesn't come across as too partisan, but I think people kind of have checked the box and know who Donald Trump is. They're not expecting him to be any more outlandish than he will be, or break any more norms than he will break. I think the debates hold a great risk and a great opportunity for Vice President Biden, because as he gets out and is going to campaign sort of very sparingly out there, the question is, if the president makes his attack on Biden's capacity, on his ability to articulate, on his ability to be a strong leader, and Biden can't stand up to that and has a poor performance that could affect it. The second point I would make is, what I would advise all of us to do is to turn off our TVs after the debate and not watch, whether it's MSNBC or CNN or Fox News, but look at social media. If you look at the social media impressions after both conventions, you may not realize this, but Herschel Walker, the former football player, the NFL football player, got almost double as many impressions as anyone but Michelle Obama. Including Vice President Biden, including President Trump. And so the way some of these debates will play out may not be what the talking heads tell us we should think, but how people interact and how the campaigns increasingly are using social media to change people's opinion and drive debates. And I think that's going to become a factor. Speaking of EHI and technology.
Great. Lauren, any final thoughts there?
No, I agree with Dean. I mean, I personally don't watch Fox or MSNBC or CNN at all anymore. I think everyone needs to make kind of their own decisions about what they're hearing directly from the candidates. But I 100% agree with Dean. I think social media is where it's at.
Well, we've gone over by a minute or two, but I do want to thank our panelists today, Catherine, Lauren, Dean. Thank you so much. We'll have to have you back after the election and get your perspectives. Thanks, everybody.
Thank you so much. Stay safe.
Thanks.
Bye.